Apple Health for Workers with Disabilities. This presentation is a comprehensive overview of the Apple Health for Workers with Disabilities program. This information is intended for stakeholders, community partners, and those who assist individuals to apply for Apple Health. The topics that will be covered in this presentation are an overview of the program requirements, how Apple Health for Workers with Disabilities or HWD is different from other programs, the disability requirements, employment requirements, how monthly premiums are established, HWD and how it's related to Medicare buy-in, HWD and home and community-based services, an update on the resource exclusion, how to apply for HWD, and some takeaway resources. Program requirements. Apple Health for Workers with Disabilities or HWD is a program that supports individuals who have a disability and want to work. What is special about HWD is this program does not impose an income or asset test. However, if an individual qualifies for Apple Health for Adults, Apple Health for Pregnant Individuals, Supplemental Security Income, or SSI, Medicaid, or a Medicaid protection under Section 1619B of the Social Security Act, they will not need to apply for the HWD program. To qualify for HWD, the person must be a Washington State resident, employed full or part-time, that includes self-employment, meet the federal disability requirements determined by the Social Security Administration or the Non-Grant Medical Assistance Program or NGMA. For more information, we have links available on the resources slide of this presentation, and we have the Washington Administrative Code 182-511-1050. How is HWD different from other programs? HWD is different from other programs because there is no income limit or resource test. Instead, those who qualify for the program only pay a monthly premium instead of meeting a spend-down liability or having to participate in the cost of care for long-term services and support. Those who reside in an alternate living facility, such as an adult family home, pay their monthly premium and their room and board. With HWD, you have specialized staff who manage this program. Some things to consider about HWD and other Apple Health programs. Any incurred medical expenses do not reduce the HWD premium, but they can be used to meet spend down for other coverage before enrolling in HWD. HWD allows earnings about the substantial gain activity or SGA level, such as $1,550 for disability and $2,590 for blindness, and does not have a test for resources. If the individual's earnings are less than the SGA level or Title II income has not stopped, then other choices include institutional rules and community first choice, where the resource limit will then apply. Individuals who are approved for Apple Health for HWD will have less out-of-pocket cost and categorically needy coverage for 12 months as long as the monthly premiums are paid. For more information about the rule, we have listed the WAC on this slide, 182-511-1000. Disability requirements. There are two definitions of disability for HWD. The basic coverage group includes individuals who are currently receiving Title II income, such as Social Security disability, disabled adult children or DAC, childhood disability benefits CDB, and disabled widower benefits BWB, or approved for the NGMA program determined by the Disability Determination Services. For non-grant medical assistance (NGMA), DDS determines whether a disability exists for the purposes of medical coverage only. For more information, visit the WAC listed here, 182-511-1150. The second disability definition is determined by the Medical Improvement Group, or MIG, that includes individuals previously eligible for HWD and were a member of the basic coverage group, as I described in the previous slide, who have a medically improved disability that is described in section 1902, who no longer meet the initial disability standard and who continue to have a severe medically determinable impairment. Having the MIG option or basic coverage group ensures that an individual who continues to have a significant impairment may continue to receive healthcare services that support their employment. Employment requirements. Individuals must be employed to qualify for HWD. This includes those who are paid for work activity with earnings that are subject to the federal taxes unless prohibited by law, such as tribal employment and sheltered workshops. Those who are self-employed, they must maintain business records, license, and IRS self-employment form. There is not a minimum number of hours to work or amount of earnings required for HWD. For more information, refer to WAC 182-511-1200. The following is a scenario to help you determine if this is an example of someone who is self-employed. Example 1. Mrs. Bell reports she started babysitting for her grandchild while her daughter works. Sometimes the child comes to her home, but usually she goes to her daughter's home because the child's toys and other items are there. She does not babysit for anyone else. She receives about $20 a week from her daughter. Although a caregiver is a recognized occupation, Mrs. Bell is not holding herself out as a provider of daycare services, nor does she have intent to produce income. Note: no minimum number of hours or amount of profit is required. Is this considered self-employment? The answer is no. Mrs. Bell is not considered to be self-employed. HWD does not require a minimum number of hours to work, nor does it require a certain amount of income to earn. But this scenario shows us that Mrs. Bell is not holding herself out as a provider of daycare services, nor does she have the intent to produce income. Scenario number 2. Example 2. Mr. Leons, an SSDI recipient, reports that since he needed extra money to meet his rent and food expenses, he started collecting aluminum cans from the street. He redeems them at the recycle center for cash. Sometimes his neighbors or local organizations call him to pick up their cans. He does not file any tax returns, and he does not pay any income tax. He does not have any income to produce. 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 He does not have any inc but he thinks he makes about $200 a month. Is this considered self-employment? The answer is yes. Since this is an ongoing, regular activity that includes some third-party collection pickups, it is intended to produce income. Mr. Lyons will need to make sure he provides a completed IRS form or some sort of business records describing his scenario. Scenario number 3. Example 3. Mr. Kent reports that he earned some money cutting the lawn for one of his neighbors. His car needed some repairs, and he did not have the money. His neighbor told Mr. Kent that he could cut his lawn for the month of July for $80. Since he needed the cash to pay for the repair, he decided to cut the lawn. Mr. Kent is not holding himself out as a lawn service. Is this considered self-employment? The answer is no. This is not an ongoing regular activity, nor does Mr. Kent plan to do this activity to make a profit, only to earn enough to pay for the car repair. If an individual's employment ends after they are enrolled in HWD, continued enrollment can continue through their current 12-month certification period if their job loss is the result of a health crisis or involuntary dismissal, they intend to return to work after the health crisis or continue to look for a new job, and they continue to pay their monthly premiums. It is important to notify the HWD worker if there is a change so that their monthly premium amount can be adjusted. Also, individuals must be employed at the time of application and when it is time for them for renewal to remain eligible for HWD. Monthly premiums. There are two calculations to determine the monthly premium amount. The premium that is the lesser amount is chosen. First is determining what 7.5% is of the individual's total amount, or the total of 50% of an earned income above the SSI standard of $943, 5% of the all unearned income, and 2.5% of earned income after deducting $65. The only income counted for an individual who is on HWD is the gross income. If there are two individuals who are married and apply for this program, each will have their own premium payment based on their own income. Amounts deducted by federal statute are indicated in WAC 182-512-0880. American Indian Alaska Native individuals are not required to pay premiums for the HWD program. This is a sample of a breakdown of income. We have $1,141 listed as an earned income and $2,065 as earnings. Using the premium calculation shows how the unearned income is subtracted using the SSI income standard of $943 that totals $198. 50% of the result equals to $99. Then calculating 5% of the unearned income equals $57, which is another part of the premium. Because the individual also has earnings, the total amount is subtracted by $65, equaling $2,000, and then 2.5% of that is $50. That is also added to the premium amount. When you total $99 plus $57 and $50, you get a total of $206, which is what the total premium amount will be for the individual. If the second option to calculate the premium is used as sampled here, where you combine the total and amount, that equals $3,206, and take 7.5% of that, which total is $240 for the premium using this calculation. $240 is a higher premium using this calculation, and when you compare it to the previous slide using the more detailed calculation of $206, the lesser of the two premiums will be used, which is the $206 we have highlighted on this slide. The Office of Financial Recovery, or OFR, mail the premium notices on the last Monday of each month. Payments are due on the 15th of the month. First-time payments will have a return envelope to send to OFR. After the first payment, individuals can set up a secure access Washington account and pay their premiums online. For retroactive requests for coverage, they must be paid in advance. We have included a link on this slide for online payment information. If the individual on HWD falls behind on paying their premiums, a letter will be sent to them letting them know their coverage will end and they will have one more opportunity to pay. If HWD is closed for non-payment, the individual will not be able to reapply for HWD for 4 months. A sanction will be placed on their case that will not allow them to be eligible for HWD unless the individual pays their premiums in full, or they can wait and after the 4-month sanction, they can reapply for HWD. There are no exceptions that apply for non-payment. HWD and Medicare buy-in. Those who are eligible for HWD and on Medicare can have their Medicare premiums paid for by the Medicare Savings Program, or MSP. For those with higher income, can also have their Medicare costs paid for when they're approved for QMB or SLMB. Payment for Part B of their Medicare begins on the 3rd month they become eligible for either program. As of January 2024, Medicare Part B premium is $174.70. For more information, see WAC 182-517-0300. HWD and home and community-based services. HWD is included in the Division of Developmental Disabilities and the Home and Community Services waivers. Depending on the income received, the individuals can be switched between the two waivers to remain eligible. Those who reside in an alternate living facility do not pay towards the cost of care. They only pay their room and board and the HWD premium. As of January 2024, The special income level income standard is now $2,829. New resource exclusion. Those who are on the HWD program can save earnings that will not be counted for other Apple Health Medicaid eligibility in the future. In order to do so, the individuals, while still enrolled in HWD, must designate a separate account for their earnings. They cannot commingle their funds with other income, and they must cooperate with the Department of Social and Health Services to establish and identify their accounts and maintain its exclusion when applying for a different Apple Health program after HWD. Funds in this or any other account do not affect eligibility for HWD. How to apply? Those interested in applying for HWD have several options. They can apply online at washingtonconnection.org or submit a paper application at the address listed on the slide and address it to Aging and Long-Term Services Administration and Home and Community Services. They can fax their paper application or call at the number listed on the slide and request an application be sent to them. Home and Community Services has dedicated staff to manage HWD cases. Resources. There are multiple new outreach materials to promote the Apple Health for Workers with Disabilities program. We have a video that is available in a 30-second standard format and a 15-second vertical format for posting on social media platforms. It has also been translated into Spanish. You can find the English and Spanish videos online at hca.wa.gov/HWD. This flyer is available in English and Spanish. The rack card here is a smaller version of the flyer available in English. We also have materials designed for a native audience, including this flyer. View the Outreach Toolkit to access the flyer, videos, and social media posts. Pathways to Employment is a set of tools to help individuals with blindness or disability to help them make informed decisions about going to work. The website was created to help people better understand their benefits and reduce their fear by showing changes to benefits that can come from working and how to plan for them and make plans for their future. Visit pathwaystoemployment.gov for more information. For more information about HWD, we have a list of links here as well as HWD fact sheet. For links to specific WACs that were listed on certain slides, we have included them here on this slide. This concludes the presentation on Apple Health for Workers with Disabilities. At this time, we would like to open the floor for your questions.